on prevention, we're still having hundreds of thousands of Americans infected every day. And for them, and especially having had somebody close to me get very sick with the illness, I've been really focused on the issue of therapeutics, treatment for people who didn't get the vaccine in time, for whom prevention didn't work, who did get it. I know that's a new focus, too. What can you tell us about, if anything's on the horizon, in terms of treating people who are already sick to prevent them from dying?
Yeah, that's something that we really are challenged with and have to do better with. We have treatments now, relatively speaking, more effective for people with advanced disease to prevent them from dying and prevent them from having a deteriorating course. So, for example, there have been clinical trials that have shown in individuals who are hospitalized, even those who require mechanical ventilation or who have a requirement for high-flow oxygen, if you give them a drug in a randomized placebo-controlled trial, a very commonly used drug called dexamethasone, you could diminish significantly the 28-day mortality. We have monoclonal antibodies, which are antibodies that are specific for the virus that you can derive from individuals by taking their cells out and having those cells produce these antibodies. There are a number of them that have been promising enough that they have been granted emergency use authorization. We've got to get more of that, and we've got to give it to people earlier. But the real goal, Rachel, is to do what we did so successfully with HIV, to get direct-acting antiviral drugs so that when someone comes in with symptoms, to prevent them from going in the hospital, you might give them a 7 to 10-day course, unlike HIV, which requires a lifetime, of course, but the same type of drug, one that's a very powerful drug directly acting on the virus itself. That's something that we're putting a lot of effort in. And when we get that, that will really turn around the entire situation of our ability to prevent someone from progressing and going into a state where they really have advanced disease.